Hi, welcome to this session of 5 Minutes with the Expert. We have with us Dr. Basil Nasrallah again. He's a consultant pediatrician at Emirates Specialty Hospital in Healthcare City, and he's having a special interest in allergy as well as asthma. Welcome, Dr. Basil, again.
Thank you, Dr. Sardar. Nice to be with you again on your YouTube channel.
Thank you. And the topic currently that worries most parents is allergy. And when you should really meet an allergy specialist and when we should do skin testing. So we have problems like eczema, we have problems like hay fever, asthma, allergic rhinitis. So food allergy, which is one of the most common ones. So can you give a brief outline of when you really think of serious allergy and when you need skin prick testing? Is it only for respiratory problems, or would you consider that in food allergy as well, where you don't have a clear allergen identified?
Thank you, Sridhar, again for this invitation and very important topic, which is allergy. Allergy is on a rise. Allergy is increasing every day. We are seeing more and more patients complaining of allergies. The patients, the community, the doctors are more aware of allergy nowadays in compared to a few years back. And that's a good thing. So allergy is a general term referred to a lot of diseases, and the most common diseases of allergy we see is food allergy, eczema, allergic rhinitis, and asthma. In infancy, before the first year of age, most of common reasons for referral to the allergic clinic is food allergy and eczema, really. And these present as early as few months of age. In the first even 1 month of age, they may present with cow's milk allergy, then the eczema start to appear, and later the allergic rhinitis and asthma start to appear after the first year of age. So allergy can happen or can start early from the first few weeks of life. I always ask parents in my clinic about history of allergy, which will give me a lot of information about the chances of the child of developing allergy. So atopy in the family, if the parents have allergies, if the sibling have allergy, that will increase the chances of the newborn to have allergy too. Most of the allergy, as we said, start with food allergy, and the most common food allergy is cow's milk allergy. This is especially when the parents decided to go for formula instead of breast, and then they start to notice the allergy symptoms. What are the allergy symptoms in food allergy and cow's milk allergy? Then when the child receives the milk or the food later after 4 to 6 months that he's allergic to, they develop a reaction. The reaction is redness, swelling of the lips, swelling of the eyes, rash, vomiting, diarrhea, colic. The child is miserable, the child is not happy. These are the signs and symptoms of acute allergic reaction, which is immediate allergic reaction, which is happening within 15 minutes to maximum 2 hours of taking the allergens, which could be the milk in the first few weeks of life or the food after 4 months of age. So this is the typical of acute IgE mediated direct allergy. But there are other signs of allergy which can be related to milk or other food, which called non-direct, non-IgE mediated, which is a bit difficult to diagnose. And this is where we find the challenge in diagnosis such cases. And this is where we get the referrals most of the time from our colleagues pediatrician. The first reaction is easy to diagnose. Even the mother and parents diagnose the child to have allergy because as soon as they give the food, the symptoms appear. The second type is more difficult, more challenging because the symptoms are hidden. The child may present to us with colic. The child may present to us with a bit of regurg, with dryness of the skin and eczema, or the child just miserable. He's not happy. He's not gaining weight. So these are a hidden.
This is the type with blood in the stools as well, isn't it? Mucus and
blood and stool in severe cases. So these are hidden symptoms. Sometimes the parents don't recognize or think about allergy. Even some of the colleague pediatricians, they don't think about allergies, and they miss the diagnosis. So this is important to have a high suspicion for milk allergy and food allergy in such cases. And the good thing that in Dubai and UAE, I can see that doctors are more aware of allergies, and they start to pick these cases early on and refer them early on. The role of testing, this is, we talked about symptoms and diagnose and the history. The role of testing is also important. There are different ways of testing for allergy. After you take the history and do the examination, you think about how to confirm the diagnosis. The two most common tests used, blood test and the skin allergy test. Each one has advantages and disadvantages. The blood test, it's a bit expensive. It's a bit invasive because you have to take a blood sample, um, and it takes time to get the results. Maybe it takes 2 to 3 days, and frankly, it's not 100% accurate in compare with the skin test allergy testing. Skin test allergy testing is cheaper. It's have higher sensitivity and specificity. It's immediate, less painful, and the results within 10 minutes. You can in the clinic make the decision about the allergy after, of course, taking a good history and rule out the causes. So
You
I
can be more
prefer skin test.
specific with the testing, isn't it? For skin test, you can decide which one you test based on the history.
Of course, always in allergy, I don't recommend to do just a blanket test, because you will have a lot of false positives, and this will confuse the parents, and this will confuse the doctors, and they don't know what to do next. So always focused history and testing. The skin test help you to choose the specific allergies you are suspecting, and testing them and do the probability and the likelihood, and then reach the conclusion, is this allergy or not.
What about the earliest age you can do the skin test?
Skin test we can do. I do skin testing from the first month of age. I can do, and it give us good results. Most of the allergies start later, really after the second month, and the first 4 months of age, mainly it's cow's milk allergy.
Okay.
We see more cases of food allergy after they start to introduce solids, which is after the 4th month of age. This is when the parents start to come and they are worried about food allergy to wheat, to the egg, to the fish, the nuts, soya. So this is where we can start to pick up more and more allergy after 6 months of age. So after we reach to the diagnosis using the blood test or the skin test, which I said skin test is better in such a case, then we put a plan with the parents, explain to them how to manage this allergy, how to avoid for the time being the allergen, and then challenge at some point and retest every 6 months to 1 year, because allergies, most of the children outgrow allergy. Allergy is not lifelong. And there is no point to stop the food from kids for too long, because we can see that most of these foods or most of the kids outgrow these allergies, and they become tolerant to them with age and with time.
Just one quick question. I mean, because it's a useful topic to the parents, I mean, can you briefly tell us about the Epipen, when to consider using it?
Sure. Epipen also is a life-saving device. It's available in the UAE, and we are lucky here to have it. Other countries around us, they don't have the Epipen. Epipen has 2 doses, the junior and the adult Epipen. The junior, it's usually used for kids below 25 kilos. We use it when there is an acute anaphylactic reaction. If the child is allergic, for example, to some food like peanut, and by mistake he ate the peanut in the cake or in a party and developed acute reaction, anaphylactic reaction, where he started to have airway involvement. wheeze, cough, shortness of breath, or collapse, this is the time when you have to act immediately and quickly and inject the child with the EpiPen on the thigh. And we train the parents how to use it with a dummy EpiPen in the clinic. This is a life-saving measure. And this is, I think, the most important message I can give from this meeting with you, the importance of prescribing EpiPen and training the parents how to use it, because this is how they're gonna save the life of their child if by mistake he ate something and caused anaphylaxis to them.
And obviously, there are reference sources where you can get guidance on which child needs EpiPen and how to use it.
Sure. Yes, the EpiPen, there are a lot of guidance. We will go with the parents to explain to them how to use the EpiPen. Yeah, most of the kids who have a severe food allergy and they have underlying asthma, they are eligible for the EpiPen. Some schools, like in America, they prefer to give EpiPen to the low threshold, to give EpiPen to most of the allergic children. Some schools in Europe and UK, they prefer to give it to severe reactions and asthmatic kids. But in general, EpiPen, even if you give it and you don't use it, it's a safe device, a life-saving device, and it's worth to have it.
Thank you. I mean, that was very useful. And I mean, again, we will relabel sessions as just sessions with the expert and not 5-minute sessions, because we cannot curtail the time because of the need of the parents to know more about it. I really appreciate your coming and discussing. Very clear, and I'm sure it will be very helpful. Thank you so much.
Thank you, Dr. Sridhar, and I hope in the future we'll have a longer sessions to explain more. Thank you. Thank you.
Thank you.